Okay, next. So after Ellacor, not saying that Ellacor is your number one, but it is one of your top procedures.
Mhm.
What is the next thing that you're super excited about in 2024?
We were just talking about under eye circles and bags and how people always complain about that. So I think that's one of my biggest complaints. One of my favorite ways of treating it is by using platelet-rich fibrin, which we also just briefly mentioned. So platelet-rich fibrin is similar to PRP or platelet-rich plasma, which is where we, take your blood, we spin it down, and we take these growth factors and we kind of inject it in the area we want response. So when it comes to under eye hollows or some shadows around the mouth or shadows along the chin, instead of just using hyaluronic acid filler, which is what we used to do, which caused a lot more puffiness and fluid retention, we can now use collagen stimulating treatments like PRF, which is what I really enjoy doing. And I get really great results from it. It's a series of treatments. And so we have to see patients like every month, and we do about 3 to 4 PRF treatments. The results are much more subtle, I would say, than doing hyaluronic acid filler treatments. The results tend to be, they last longer, I think, in younger patients than in older patients. And most people do need maintenance treatments, but they are much more natural looking because we're not completely eliminating that junction between the cheek and the eye. We're just softening it up so that it looks much more natural and it moves a lot nicer when patients smile without causing that bulge that we can see sometimes with hyaluronic acid filler.
For people that have sunken in areas under their eyes, I would say like 10 or 15 years ago, we were doing hyaluronic acid under the eyes. And some people are still doing that.
Mhm.
And I actually have a story. This was back in 2009. And I was at an ENT doctor in Hawaii. And I said, "Do you ever do hyaluronic acid under the eyes?" I should have known. He goes, "No, but I can try." And
Oh
he
no.
injected it under my eyes. And I guarantee up to 2015, if you saw me stand across the room, you can still see bags under the eyes because I feel like these molecules, they migrate and gravity pulls them
Mhm.
down. And then it almost looks like instead of filling the hollows over time, they kind of migrate and they sometimes come to the surface too, maybe from smiling, we're pushing them out. And I just have never been happy with the way they look. When I was in a cosmetic practice, I'd always send them to my partner because she loved it, but I did not. I wouldn't do it. So I love the fact that there's PRF now to help with the hollows under the eyes because it's your own body. You're drawing your
Mhm.
blood, you're spinning it down and centrifuging it. You're taking the platelet-rich fibrin instead
Correct.
of the platelet-rich pla- uh,
So
plate
yeah, the
plasma.
platelet-rich plasma. Yeah, the difference. So there are people who do PRP injections under the eyes. I think PRF works better. It's very similar to PRP, but the way we make PRF is different. So plasma is more liquidy, and when we make PRP, those tubes that we draw the blood in, they have anticoagulant, meaning it doesn't clot the blood. So that way it stays liquid, and we can use it and inject it much more easily. The PRF tubes don't have an anticoagulant. So meaning that once we make that platelet-rich fibrin, fibrin is technically a clot. And so we take out, and that clot has they have a lot of growth factors. So we're literally taking out a fibrin clot before it starts clotting. But once it's more jelly-like, and then I inject it under the eyes, what then happens is that it clots right under the eyes where I've injected. I don't want people to get scared. It's not like a blood clot. I'm not injected into blood vessels, but I'm injecting this fibrin matrix under the eyes, and it becomes a little bit more solidified. It stays there for about 3 to 5 days, and it slowly releases these growth factors over 3 to 5 days, versus PRP, which releases growth factors within 3 to 4 hours. So when we have a slower release of growth factors, we're going to have an increased collagen stimulatory capability. I don't inject PRF for the hair, and that's because I'm afraid that you can have the opposite, where when you inject PRF and it kind of clots in that area, then you can have congestion of the hair follicle, which can then
Mm.
cause hair loss, theoretically. So I do PRP for hair loss, but I do PRF as filler because of the fibrin clot, the matrix, like, and how long it stays under the skin once it's injected.
That's really great. That's a great explanation. Okay, so it's a thicker matrix, so it kind of fills in that hollow a little bit
Mm-hmm.
better. Or if somebody has like, eye bags,
Mm-hmm.
how do you technically make that visually look better without because
Correct.
surgically we're not removing the
We're
bags.
not removing it.
So you're
Yeah.
doing the procedure to make it appear like the bags aren't there when people look
Yeah.
at you.
same concept as a filler, right? When we inject normal filler into the hollow, whether the hollowness is caused by bony loss or whether the hollowness is caused by the bags, the eye bags, which are the fat pads that have dropped, we're still kind of using it to camouflage. So we're doing the same thing with PRF. I will sometimes combine PRF with like other modalities, like, the microneedling with radio frequency. So I can help tighten that skin better. I can maybe help if we can tighten that skin better, it will help camouflage those under eye bags better. Or I will combine it with something called Tixel. Tixel is a device that's not technically a laser, but it releases heat in like a grid-like pattern. And so it's not injuring the skin, it's not removing any skin, it's not puncturing the skin. It's simply just these titanium needles that when they touch the skin, it delivers heat. And it delivers the heat in like a fraction of a second. And so we can control how much heat is being delivered. And so I will sometimes combine that with PRF, which is a very simple, low downtime treatment. The thing about PRF that we have to discuss, I think, so once you inject it, it's full. You're like, oh my gosh, it looks so great, it's full. But then the fullness goes away. And then we inject it again, the fullness goes away. So it takes a few months after the treatments are completed to then get that collagen production to help fill that hollowness. And it can last about 6 to 9 months. I think for younger patients, it lasts a lot longer because they are breaking down collagen at a slower rate. And then the older patients, they might need maintenance treatments, once a year or once every, 9 months. I actually have a similar filler story that you do for the under eye filler. I was a surgical fellow at UCSD like 7 years ago, and a resident wanted to learn how to do filler. And I had these like, I'm Indian. And so we have these like under the eye circles and these hollowness, and I hated them. And she filled them. And then I like rubbed my eyes because it was so itchy, and the filler migrated down. And I had these like two puffy things of filler for like 3 years. Then I finally dissolved it, and I've done other things to help with my under eyes. But yeah, I have the same filler story. So while I do inject hyaluronic acid filler for tear troughs, what I will do sometimes for patients who don't want surgery but they still want to help improve is I'll do a series of PRF sessions first. I will improve the quality of their skin. So right when we increase collagen, we're going to thicken that skin, and then that's going to hold that filler a lot better than if we don't improve their skin quality
Right.
prior.
Yeah. And that's kind of what we're saying. It's not like there's one
Yeah.
thing for everyone. And we're
Right.
not saying that all hyaluronic acid is bad, but like you have to really get the bespoke treatment plan for yourself
Yes.
that's going to work. And there's a lot of treatments out there. And I think also we don't necessarily need an entire syringe of hyaluronic acid. Like
Mm-mm.
less is more because it does tend to move and migrate. And you can reverse it if you're someone who doesn't like the placement of a filler, or if it has moved, which I think with ultrasound studies,
Mm-hmm.
they're seeing a lot of these fillers move into planes that we don't think they're in.
Mm-hmm.
Then you can have the filler dissolved. If it's a hyaluronic acid based filler, it could be dissolved with an enzyme called hyaluronidase, which can help it sort of melt apart.
Yeah, the MRI studies like found that filler was in a different plane, so in a different tissue plane, even 15 years after injection. And when I've done skin cancer surgeries on the lips or around the eyes, I actually see it underneath the microscope. And the patient even forgot that they had filler done. They're like, I've never had filler done. And I'm like, are you sure? Because I can see it. Like underneath the microscope. And they're like, oh, yeah, but that was 20 years ago. It's long gone. But we know now that it doesn't truly go away. It just goes, it loses its benefit. Like it's not in the place we want it to be, but it's still in the face. It's just in a different tissue plane, which can then sometimes it does nothing. But over time, if we keep on pumping filler and the filler is just going to a different tissue plane, that's when we get the balloon, like the overfilled syndrome, right? Which is you can I think there's certain celebrities like Courtney Cox from Friends, Monica Geller. She had like filler done and she was starting to balloon up and then she got it all dissolved.
Yeah.
And that was just because too much filler was placed over time.
Right. I
Yeah.
know. I mean, it's such a process. Like we think we know so much, we think we're doing everything right, and then in retrospect, we reassess and we just keep going back to balance. Like we
Hmm.
keep wanting to go back to balance, like what looks the most balanced, and we have so
Hmm.
many more things nowadays. When I trained, we had no fillers. We had collagen. That was about it. So, I mean, we've come a really long way. Okay, so with PRF, so under the eyes is a great spot. Where else can you do PRF?
So we can make PRF, and then there's a slightly different way of making PRF for the rest of the face, or I make it a little bit differently for the rest of the face. I want to make it a little bit more thicker. I'm going to try to
Well,
simplify
let's get
this,
this
but
clear. Really, I'm making
yes.
it and you're taking it from my body. Just kidding.
I know you are making it.
Or whoever's, no, we're
You're like,
just
it's
teasing.
my growth factors.
Well, because,
Uh,
I'm sorry, everyone, because we're drawing blood. So we're drawing
yes.
the person's blood. So you're making your own PRF.
Yes, you're making it, but I'm going to take it and I process it. And we process it a little bit differently for the face to make it thicker. And so I can inject it anywhere on the face, which is so nice. I can inject it just like filler. I can inject it in, these what we call the nasolabial folds. I inject it into the cheeks, the temples, the marionette lines, which are these shadows here. I can even inject it into the lips to kind of help define that lip border better. I actually combine PRF with like Sculptra, which is that collagen simulating filler, or I will combine it with Radiesse, which is another biostimulatory filler. Like if I'm filling the chest or the neck, I will actually combine it with those because I want not only the regenerative capabilities of PRF, but I want the healing capabilities because it helps speed up healing because there's so many growth factors, right? When we think about the healing process, if we have a cut on the skin, it's the fibrin matrix, which then creates the scaffold for healing of the body to occur. So very similarly, we're trying to use those capabilities for, other parts of the body. I even use it after I do Ellacor. I'll take PRP or PRF and inject it to help with healing with lasers. I use it in a lot of different ways. We can when it comes to PRF. But yes, I to answer your question in a very long-winded way, we can use it on other parts of the face and neck. It's not useful, for example, I can't inject PRF into the stomach and tighten it up, right? So it's mainly it's for thinner skin.
That's really fascinating. I didn't even know that you were doing all that. And then as far as when people can see results, it's sort of like you mentioned with the eyes. So if
Mhm.
you're doing it in the face, they'll see an immediate result and then
Correct.
it will fade and then slowly build over what, the next 3 months or so?
Exactly. So they'll see an immediate result because there's volumization happening just from injecting liquid. Within 3 days, that the water goes away. I do a series of treatments, but I usually say by the second treatment, you'll be like, oh yeah, I see a little bit, I see some softening. And then it takes about 2 months after the third treatment to start noticing that collagen production. The thing we have to remember though about these collagen producing treatments is that results are variable. Some people
Mhm.
just naturally make more collagen than others. Right now, I don't have any way of predicting who's going to make more collagen compared to another person.
Right. And we're also
So,
aging at the time that we're
mhm,
expecting results as well. So there's so
exactly.
many variables, but I love procedures like that because I always think like, okay, if you look at yourself today and then you look at yourself in 2 years, like you're slowly reverse aging so
Mhm,
slowly that nobody can figure it out. And you never get the, what did you do? You just,
exactly.
all of it, you just slowly look better that people you
Yeah.
haven't seen in a few years will say like, oh, wow, you look really good.
Yeah. And that's the goal. Like, we shouldn't all look like Kim Kardashian after one visit to a cosmetic doctor. It looks bad. I also like to under promise and over deliver. So, anyone who ever wants to do PRF, I'm like, listen, it's going to be so subtle, like very subtle results. And if you get more than subtle improvement, I'm really happy for you. But the whole point of all of this is, doing what's called collagen banking. We just want to, since we're losing collagen, we want to bank our collagen. We want to have more and more and more collagen in a healthy way where we continue to kind of, like you said, slowly age backwards or keep where we are.
Yeah, I mean, and sometimes it's not sexy to just like make sure your foundation of your house is really strong, but that's really what
Right.
we're focusing on here because you
Exactly.
start decorating the upstairs and the foundation falls apart and who cares about what, the upstairs looks
Yeah.
like. So,
Yeah. That's a great analogy.
okay, so where do would exosomes to come into play with all of this? So, like you hear a lot about exosomes and stem cells and PRP
Hmm.
and PRF, and I feel like you did a really good job explaining the difference between PRP and PRF and them sending signals to help kind of boost cell growth
Right.
and renewal. But like, how does that compare to stem cells, which we can't use in the US, and then exosomes?
Correct. So the nice thing about PRP and PRF is that they're autologous treatments, meaning that they come from your own body. Therefore, when it comes to FDA regulation, it's a lot less stringent, but it's also a lot safer because you're making it. I'm just taking it and putting it into an area where I think you need it. Exosomes are coming from somewhere else, right? So they're coming from other stem cells. They're not coming from your own body stem cells. So they're what we call allogenic. Hopefully I pronounced that right, but they're not coming from you. So exosomes are, scientifically speaking, they're extracellular vesicles. So I call them like mailmen. They are like little, there's like a postal service, and they're delivering messages to other cells. So that's actually where extracellular vesicles or exosomes are. So exosomes are little envelopes, and they contain, peptides or proteins or what we call nucleic acids, which are the building blocks of DNA. And one cell will send this exosome to another cell to communicate, hey, I want you to do this. And so when we get exosomes for a cosmetic practice, we're getting them from stem cells, but we're not able to control what's inside that exosome. Like, what is that mailman actually carrying? We don't know. So when they're processed and they're put into tiny little cute glass bottles, and we call them exosomes, it's not regulated what's inside those exosomes. It's not regulated what the exosomes carry. So we're like, okay, well, exosomes carry all of these communication materials that cells use, and we have some studies to show that it does help with like collagen regeneration. It can help with, also improving healing outcomes, but we don't have enough research yet. It's also not FDA approved, right? So that's where it becomes much more complex when we're trying to give it to patients. Now they're not ingesting it, so they're using it topically. However, because it's not FDA approved, the counseling is a lot different when it comes to patients, because we want to make sure that there's no harm done from using exosomes in practice. I'll be honest, I personally have not used exosomes at UCSD because it's not FDA approved. And we're in an academic center, so we're much more careful about what we're using for our cosmetic patients. I would want more research. I think one of the things that I'm also worried about with exosomes is that, they're coming from stem cells, and stem cells like to grow. So the job of a stem cell is to grow and create more cells, that either stem cells or cells that we want them to become. And so a lot of these vesicles from stem cells are going to contain messengers that cause cell proliferation. They want cells to
Cell
grow.
growth. Yeah.
Cell growth. So then does that create an oncogenic potential? So does that theoretically increase risk of maybe skin cancers? We don't know. We don't have enough research. I think I'm a skin cancer surgeon as well. So I think that's like the first thought I have when it comes to using exosomes. So we don't know, and probably the risk is very low. I think we had the same thought about PRP and PRF, which contain growth factors, and we now have studies to show that PRP and PRF do not increase they don't have an oncogenic potential. It's so probably the same with exosomes, but I just feel like we don't have enough research to show how effective they are. However, I also don't think that while I talk about these theoretical risks, I don't think that they're in practice are probably not that harmful.
Right. It's sort of like what you were saying about the high protein. Like, we need high protein so that we have the amino acids to build collagen, right? But high protein diets also promote mTOR, and mTOR can promote cancer. But,
right.
So then you want to cycle, we want to cycle everything. We want to be in phases of growth. We want to be in phases of cell breakdown and regeneration and things like that, whether it's our whole body as a system or even during the healing process. We need to form a time where we clean up, and then a time where we build, and then a time to clean up and a time to build. And I think that's why, just going back to this whole discussion, nothing is all good and nothing is all bad. Like, there's a time and a place for everything. I have a lot of friends who use exosomes, and some of them swear by it. They say they know that if they put exosomes on one side of the face after laser or after microneedling, it heals so much faster. They are kind of expensive. So you have to keep this in mind. Also, like, where your dollars are going and what's going to be the most cost-effective way to spend your dollars. So I don't know. I mean, I'm excited about them, but it's in the TBD kind of category for me as well. And I think the most fascinating thing that you said that I have never heard before, and I've been hearing about exosomes since 2016, is the fact that you don't know what the message is going to be, right?
Yeah.
I'd never
We
thought
can't
about
control
that.
it. Yeah, we just get them from stem cells, but we can't look inside the vesicle and be like, hey, what's in there? Do you have DNA material? Do you have protein? What's in there? Like, what are you going to do if I put it on something? So that's why I think like the response is hard to also predict, because it's not like every little glass bottle has the same product of exosomes.
Yeah, when they were extracted.
Right.
what was happening in the body of that person was when it was extracted. The other thing that's always been in the back of my mind, because I have used exosomes from two different companies, and you get a big report from the company saying it was checked for all sorts of different diseases,
Hmm.
because these are extracted from usually from like umbilical cord, right?
I think so. There's like a myeloid lineage, and I can't even explain right now what myeloid is, but there's two different
Bone
stem
marrow.
cell, yeah, I think bone marrow, that's right. But there's two different lineages of where they come from. And I don't remember exactly like where they come from, but it comes from people. I don't think unless they have figured out to grow it in a cell plate, which I don't think that they have yet.
No, they get them from people, and they're usually young people. So,
Right.
unlike PRP and PRF, which come from yourself, and when you need it, you're usually over 50, the health of your own stem cells is not as good when you're 50 as it
Hmm.
is when you're 20. So, that's one of the arguments why exosomes might enhance the treatment benefits.
Hmm.
But what I was going back to is you get a whole report about all the diseases that these things were checked for. But how many diseases don't we know about?
I think that all the time. I mean, how many things don't we know? We don't know
There,
so many
we
things.
know, I feel like we know like less than 1%.
I
So
agree.
it's a pure, I don't know. I mean, yeah, you can get that walking down the street. Who knows? But
Right.
it's just it's all about risk and benefits, and going back to what you said about Ellacor, like we're here to benefit. We want to minimize the risk when it comes to aesthetic procedures. We want someone to get the best benefit and have the least amount of risk possible, because it's really just there's no room for, you know.
Yeah, and these are elective treatments. They're not medically necessary procedures. So that's even more of a reason to like learn about the risk profile, and make sure. I think exosomes also sound really sexy, like exosomes, stem cells, regenerative medicine. I also love talking about all of that and longevity, and that's all up my alley. But I think we have to kind of take a step back sometimes and be like, well, what exactly, like what harm can be done because I'm using it for a cosmetic purpose, not to treat a medical illness.
Now, there's some skincare with exosomes too. Have you played
Mhm.
around with any of that?
I had a rep come to the office to discuss it with me. I haven't played around with it too much. I think when it comes to skincare with exosomes, how much of the exosomes are actually being absorbed? I think probably zero.
How
Exosomes
does,
are they're large vesicles. I think they're between 30 to 150 nanometers in size. And so I don't know how to, I mean, it's small in the grand scheme of things, but not all of them are going to absorb through the skin barrier. So I think again, it sounds really sexy, but are they actually being absorbed through the skin barrier? If it's just a topical application, I doubt much would be absorbed.
right? Unless your skin's compromised. I know that was my
Hmm.
thought too, because I tried one and I liked it, but is it the carrier vehicle that I like, or is it the
Yes.
product? Like, who knows, you know? So to be determined on that one.
There was actually, I was looking at some exosome studies. I did a journal club with some residents in the beginning of this month. And it's funny because they were looking at exosomes with hair loss. And the way they studied the exosome was they did one side where they just like, where I believe they like applied a placebo, but then they did the other side where they did microneedling with exosomes or microrolling with exosomes, and they saw an improvement. But that's how the exosome studies are. Like they're such poorly designed studies. And the reason that study was poorly designed is because you can massage the skin with microneedling and get improvement in your hair loss. So how much of that outcome was exosome related and how much was it related to just the improvement in blood flow from the microneedling device use? And so I think
Right.
we just need much better studies that really have placebo controlled studies to be able to study the efficacy of exosomes.
You ready for the third?
Sure.
Okay. What is your third excited procedure?
So actually, I haven't done much of it yet, but we just got a new treatment for hyperhidrosis. So hyperhidrosis is when you have excessive sweating, and people can have it on the underarms or like under the boobs or hands, feet, or you can have more generalized hyperhidrosis. But the most common is, in the armpits. And so it's called a Brella patch. So like the Rihanna song, like umbrella, but just Brella. And
You know
it's
all the
really
celebrity gossip. I don't know any of
I
this.
only know the songs from like 2000, but it's called a Brella patch, and it's a really cool treatment. So I think just to kind of go back, usually for excessive sweating, we have to give antiperspirants or aluminum based deodorants, or give them medications that are what we call anticholinergic medications, which have other side effects to help reduce their sweating, or Botox injections, which are super painful, or mirror drug, which is super painful. So in contrast to all of that, Brella patch is like a 3-minute treatment. It's literally a patch. The patch contains sodium ions, so just like salt, like half of salt, basically. And it's when the sodium ions interact with the sweat, which is water. The sweat also contains, salt. But when it interacts with the water within the sweat ducts, it creates a tiny little thermal injury to kind of obliterate that sweat duct, or to help calm it down. It's a complicated kind of mechanism of action, but in a way, it's also really cool because we're not injecting, we're not giving you anything that is not already what your body already makes. So this one has sodium ions. It's a 3-minute per armpit. So we put a patch on, we take it off after 3 minutes. We put another patch on, we take it off after 3 minutes. The results take about a week. So it'll take about a week for you to notice, and they can last for about 3 months. It doesn't completely eliminate sweating because we need to sweat, but it just helps reduce it so that it's much more manageable. It's right now, we're using it for patients who have moderate hyperhidrosis. So not somebody who has severe hyperhidrosis, so someone who's moderate. The reason we're not using it for the horrible sweaters is because when we create thermal injury, we can have a risk of a burn. So tiny little erosions or burns in the area. So we don't want to take that risk yet. So we're just doing it right now for the moderate hyperhidrosis patients and just seeing how it works for them. And I thought it's a really cool new treatment, cool new technology, and could potentially be life-changing for a lot of patients. I'm
Yeah,
excited how it
that sounds
works.
super excited. I think
Yeah.
that's great. So are you able to do it on hands?
And I haven't tried it yet. So right now it's just approved for armpits.
Okay.
But I
'Cause
might try other areas like under the boob. I feel like with hands, those are so sweaty that I would be scared of causing little erosions, which would then take a long time to heal. And we use our hands a lot. I think it was kind of TBD for that.
Right. Yeah, I don't feel like we have satisfactory treatments for the hands. Like
I don't.
I can do Botox under the arms like really well, and it's not painful if you numb somebody with
True.
numbing cream beforehand, but it can be pretty pricey. So where does this run in cost compared to
Yeah.
Botox?
I don't know how much you guys charge for Botox, but usually you have to use a lot of units, right? So it can be upwards of like
Uh-huh.
$500 to $800, sometimes 1,000, depending on where you're going. So the Brella patch is anywhere from 350 to 600, depending on where you are in the country.
Every 3 months. That can be a game
Every three
changer
to
for.
four months.
Yeah.
Mm-hmm.
So I used to work at the US Capitol in Washington, D.C. And, there's certain jobs like politicians or
Mm-hmm.
salespeople that you can't be sweating under your arms. So we need to have options out there. So besides just topical options, which can be really cumbersome and really stressful because it can work consistently for a few days and then not work when you're in
Right.
that important meeting, then we have
Yeah.
Botox, which can last about 6 months. And I do 100 units, so 50 units per
Mm-hmm.
axilla.
Yeah,
And
same.
yeah, so we're talking like $1,200 basically it ends up costing. And it lasts about 6 months. It takes a couple weeks to kick in. Now we have Brella, which you're seeing really good results for. And so Brella is another option for focal hyperhidrosis under the arms. Are you seeing like extra sweating on the back like we typically do if somebody is not sweating as much under their arms?
So we just got it. I don't have enough patient experience to be able to know if we're getting compensatory sweating or not.
Yeah.
I
So
think
what
since they're still going to sweat a little bit despite the Brella, I would assume maybe not as much compensatory sweating, but TBD.
Okay. So, for those of you that listen to the skin as a detox organ, and we talked about the importance of sweating. So, this is just helping minimize how much you're sweating in the sensitive, embarrassing areas. And it's
Yes.
not preventing you from detoxifying. And it's a way to prevent aluminum, which came up in a lot of DMs that I got from people just because we have such a holistic audience of people that don't want to put aluminum chloride on their skin. So this is a great option, the Brella. So how do people find if they're not in San Diego and they can't come to you for this treatment? Is there a way that they can find out who's doing these treatments since it's such a new treatment?
It's a relatively new treatment, and so it's not in all the states yet. But if you go onto the website, I think if you Google Brella and you go onto their website, they should have a list of providers who offer it.
Okay. We'll have a link in the
Yeah.
show notes.
Yeah.
Okay, great. Anything else?
No, I feel like we had a really great discussion. It was really
Okay.
fun.
It was. And I'm so glad you're on the cutting edge of these things. I love that so much. And can you just share your YouTube channel? We'll put it in the show notes, but I feel like your YouTube channel is so good. I like
Oh,
your
thank you.
visuals and I feel like you explain things really well to people. So share that with us and how people can find you.
Yeah, so my YouTube channel is at Dr. Swati Cannon, and same on Instagram, same on TikTok. And so people are welcome to find me on there. I mean, I'm
Thank
not active on TikTok and I don't do any dances.
Yeah,
So
I
it's
just
just me talking.
that's
But
exactly how it should be. So it's
uh,
so funny. One of the things I miss about San Diego is you're up on your famous people, on your celebrities. Like as you're talking, I'm like, I don't even know what Kim Kardashian looks like. I don't know about
oh,
Courtney Cox's filler face. I don't know about any of these people.
funny.
I know.
Maybe I have too much time on my hands. I don't think that's just me in San Diego. That's just me flipping through my social media.
Oh, I
And
do recall people would come in and they'd specifically pull out
yeah,
celebrities. So it's
I
fun. It's fun.
I did have somebody who wanted like the Kim Kardashian. I mean, she looks great. Kim K actually looks really great, but I think a lot of people want to look like celebrities, and I try to steer away from that. But
Yes, we want you to bring out your own best assets.
yes.
You know what's fascinating? My sister is a makeup artist. She lives in Milan and she's always sending me photos of the models before makeup and they
What a
don't
fun
look.
gig.
Yeah, but the point is that nobody looks like how we see them in the media. People look very different in the background, and we see that as dermatologists. We see the real people all the time. So
Hmm.
when you're seeing someone in the media, don't think that they look like that all the time because it makes you
Yes.
be hard on yourself, and we don't want that. We want you to just embrace who you are and love who you are and be who your best self is.
Yeah, and that's really the goal of all of these treatments is to just be a better version of you
Exactly. Well, thank
in
you.
many
Thank you,
ways.
my dear friend.
Yeah,
Appreciate
thank you for
you.
having me. This was so fun. I will see you soon.
Okay. Yes.
Thank
Bye.
you. Bye.